Coming to my question, the same, sir. I'm seeing patients they are very at very basic level. I will be seeing only few symptoms. Even though I take the case for half an hour, I could not get any characteristic symptom. There will be very few symptoms. They say only pain in knee joint, nothing more. Just on rising from a seat. So only morning aggravation. I do not get any other symptom. Even if I ask, they don't say anything. So it is my day to day practical problem. What I need to work out. So how to go in that cases with very few symptoms?
Yeah. Okay, I'll try to give you a little bit of an idea. So basically, the reason for me to do what I'm doing is because I know the problems that I faced in large part of my initial days in practice, and I know that this what I kind of went through. I wanted to make it easy for other doctors, homeopath students, so that they can, as soon as they start their practice or whenever they start seeing patients, they should be very confident to treat. You will see many cases where patients actually don't talk, and I think that is the whole skill of a homeopath. The skill of a homeopath is not in cases where patients talk a lot. I think the real skill of the patient is, especially in patients who don't talk at all. I think that's where the art portion of homeopathy comes in. The art portion of homeopath comes in. And I think these cases can respond the best to homeopathy because it's so beautiful when patient comes and says, only this is there and that's it. It's so interesting because you have to understand that how the pathology is actually forming for this person, how the disease is forming. So there are a few things that I do very often. And the first thing I do obviously is look at the chief complaint. I try to look at the origin, duration, progress of it. And I look at a lot at past history. Nowadays, I look at a lot in past history. How it started. What were the initial symptoms? What was the exciting factor? What was any diseases which were unrelated to what's happening now? Family history of illnesses. I'd give a lot of importance to that. But one of the main things that I give a lot of importance to is observations. Just observations will give you a lot of idea. Just look at this person when he's talking to you, how he's talking when he's talking to you. Just the way he's talking. Is he very rude? Is he very sensitive? Is he very shy? Gives you a lot of idea about the person, a lot of idea. So I don't try to ask too many questions that, tell me about yourself. If the patient is not talking, I just talk to him, One of my favorite questions is, what are the things you like to do? What you enjoy? That will give you a lot about the person somehow, because that's when you get a chance to converse with the patient. One patient may just straight away say, I like to read news. So I will just ask, what news you like? Which one you like? So he will say, I like Arnab Goswami. So it's a good idea to start, okay, what you like about Arnab Goswami? Which one is your favorite? Even I follow him. Actually, I don't, but still you just say, okay, what about him? And he may tell you, Arnab is nationalist and I believe in nationalism. And, you can straight away understand who is this person then. So this is something that I do. Another thing that I do a lot is I use a lot of organ-specific remedies as well. And that's one of the ways by which I have some very, very good results. So if I don't get anything at all, then I look at organ-specific remedies. For example, an old woman comes to me with a very, very bad osteoporosis. The entire bones are totally, in a bad situation. One of the remedies I use is a remedy called as parathyroidinum once a day for 4 days. So this is one of the remedies which can gradually help stabilize very, very bad cases of osteoporosis. You understand that the parathyroid hormone has a lot of calcitonin and etc. Kind of channels through which the osteoporosis, the calcium metabolism, the phosphorus metabolism is affected. So many, many such kind of clinical remedies I use, and they can really help stabilize the condition. I've written a lot about this in the book Nosodes and Sarcodes. I guess you can read it at some point. And yeah, I'm always for a lookout for more studying all these kind of pathological remedies as well. So for me, when I look at a case, I have many different ways to prescribe. I could either individualize the case, okay, or I could look at past history, family history. I could look at an anti-miasmatic. I could look at just the mind symptoms. I could look at a pathological level remedy. I could look at an organ specific remedy. I could look at an Indian remedy. So for a same case, you have so many different layers to prescribe on. So this is the added advantage that I believe, and one of the fortune that I have is that I've worked with many different homeopaths. So I know different techniques, including Segal's technique, Dr. Sankaran's technique. I worked with Dr. Sarkar, Vijay Vaishnav, Dr. Elamkan, as you know, so many different people. So the same case, I know so many different techniques, methods to solve it. And that's added advantage. And that's why I'm doing this course for all of you, where I'm inviting people from different areas to teach and also share a little bit so that you can probably use some of it.
Sure.
I hope I was able to answer some part of your question.
Yes.
Okay. Thank you. Thank you, guys.
Thank you.
Hello and namaste from Mumbai. I'm very excited to share with you that this December we are launching the advanced course on classical homeopathy. So all the homeopaths out there, students, interns, early practitioners, students anywhere, this is the thing you need to join. It's a weekend course, online course. You can sit at home and learn. In today's times, the world has been online. We are going to be talking about 100 polycrest remedies, also rare remedies, organon, repertorisation techniques, advanced level of case taking. Also, we'll also talk about how to use mother tinctures, organ remedies, biochemics. It's going to be one of its kind. Homeopaths across the world are going to be teaching also in this. And I'm working on the content of it very closely with the best minds in homeopathy. So I really want every single one of you to join us, be a revolution in this field. I'm also going to give a lot of homework to all of you. So be ready for a lot of training sessions with me. Also, there is an early bird offer. So if you register earlier, you will get it at a major discounted rate. And if you already attended my last course, you'll also in this early bird offer, you'll also get the last course, that is the 6-month classical homeopathy course, as a guest access. We are going to increase it for 6 months. So you'll also attend the last course plus this course. So it's going to be close to about 200 hours of classical homeopathy at your fingertips for the next 7-8 months. It's going to be one of its kind. So if you want to be a genuinely good homeopath and a clinician, this 200 hours will take you to the next level. So forget everything else. Forget the Netflix, forget the Amazon Prime, forget the movies, forget the stories. Classical homeopathy at its best. Just email on the below email ID, register, be a part of revolution. Every single one of you listening, hand on heart, join us.